Hi, my name is Tatyana. Have you or a loved one ever needed or have undergone an organ transplantation? If you have, I offer my sincere condolences, and if you haven't, you're in the right place. I chose my topic because many are unaware of the effects that it can have on the body, both physically and mentally. First off, what is organ transplantation? Organ transplantation is a process in which an organ is removed from one body, the donor, and transplanted into the body of another, the recipient, in order to replace a defective or absent organ. Essentially, this process is the last resort for organ failure, but it is by no means an absolute solution. My topic explores psychosocial aspects of organ transplantation. Specifically, I will highlight the challenges that patients face throughout each stage of the process. While the obvious focus of organ transplantation is concerned with the possible rejection of the organ, it is also important to consider the long-term psychosocial effects, especially if these effects result in the recipient not adhering to the immunosuppressive regimen provided. Chronic illnesses are accompanied by emotional, cognitive, and social changes that require extensive adjustments and coping skills. Preoperative and post-operative stressors affect the psychosocial changes by applying extra stress, which increases the risk of organ rejection. A diagram depicts psychological distress in transplant patients, which can double as preoperative stresses. Here you can see it names terminal organ failure, the waiting period, pre-existing psychiatric disorder, drug side effects, lifelong medications, and other medical issues. These psychosocial changes should not be considered secondary, but instead as a part of the illness. As the start of the diagnosis, the feelings of anxiety, depression, aggression, and hopelessness, hope, and confidence are an array of unpredictable emotions that constantly fluctuate as the patient adapts to the meaning of their illness. It proceeds to carry on throughout the entire preoperative period and trickles into the postoperative period. Additionally, recipients also adapt to an increasing loss of autonomy, social roles, contacts, and activities. In the end-stage organ failure, the patient has to face their limited life expectancy and the need for organ transplantation. They also face fear of death, inner conflicts, and the uncertainty of a timely transplantation, which is a prevailing emotional stressor. Being in the transplant unit can apply more stress because while getting to know the other families there can be helpful, it can also cause hopelessness for your own family. There are both short and long-term perioperative stresses. First, I'll begin with the short term. Directly after the procedure, patients can experience a post-operative delirium called acute organic brain syndrome with symptoms of mental confusion, language disturbances, and occasional hallucinations and delusions. Another is a difficulty embracing their replacement organ and feelings of remorse toward the donor, which may lead to increased psychiatric distress and noncompliance. Finally, being in the ICU and transplant units can result in PTSD. Now for the long-term stressors. Medical side effects and associated comorbidities include cardiovascular disease, hypertension, and osteoporosis, which can impede on the patient's quality of life. Other long-term issues include acute rejection, which can be avoided if caught early, organ failure, graft failure, which primarily caused by chronic allograft nephropathy, retransplantation if something goes wrong, and the problem of medical bills or inability to work during recovery, and the need to return to normalcy. With this in mind, coping mechanisms are imperative to the later successful organ acceptance. The functionality of these strategies focus less on strategy and more on flexible and adequate use. Before the procedure, it is important to take pre-transplant psychosocial evaluations to determine a patient's psychosocial characteristics and if they affect post-transplant outcomes. In doing so, a plan can be made to minimize any negative outcomes. When considering the psychosocial effects, the extent of the perceived psychosocial burden is moderated by personal and social resources, resilience factors that is, favorable coping skills, self-efficacy, sense of coherence, optimism, and social support. Psychosocial evaluation allows cognitive, behavioral, emotional, and social factors that might impair coping or adherence that should be explored, and the patient and their family should prepare as best as possible. As opposed to post-transplant psychosocial disorders, pre-transplant psychopathology does not seem to be as strongly associated with medical outcome of transplantation. Moreover, the psychosocial effects of a living donor is less understood, making them more likely to be overlooked or dismissed, as well as the well-being of the recipient tends to overshadow that of the donor. Living donors often experience financial burdens or hardships due to the recovery time after surgery, not to mention donors who suffer more adverse effects, whether that be negative health issues or psychosocial outcomes, are more likely to perceive the donation as a regret. Additionally, by choosing to donate, the donor is putting themselves at higher risk for organ failure. As a result, the donor may then require a transplant. In addition, it is also important to focus on the psychosocial effects of alcohol-related liver disease or ALD patients. ALD diagnosis is based on histological and laboratory markers along with the patient's admission of having consumed excessive amounts of alcohol. Alcohol relapse rates after transplantation vary widely between 10 and 50% depending on pro-operative selection, post-operative care, methods used to assess alcohol relapse, and the definition of what constitutes a relapse. Approximately 20% return to harmful drinking after transplantation. In closing, if you are ever in the position of needing an organ transplantation, it is most important to be informed of the psychosocial effects that occur throughout every stage that can affect both donor and recipient. Since the donor to recipient ratio is very unbalanced, it induces about a cycle of an endlessly high demand that is met with an unfulfillingly low supply. Thank you.